Can amblyopia be reversed with neuroplasticity? Imagine your brain as a flexible network that can change and adapt even as you grow older. That's the idea behind neuroplasticity, which is the brain's ability to reorganize itself by forming new connections. When it comes to amblyopia, or LASIK, this ability is key. Amblyopia happens when one doesn't develop properly during early childhood, leading to poor vision and abnormal wiring in the brain's visual areas. Traditionally, doctors believed that the window for effective treatment was only during childhood, when the brain's plasticity was at its peak. But recent studies suggest that neuroplasticity doesn't completely shut down after childhood. It persists, to some degree, into adulthood, opening the door for potential vision improvements even later in life. Neuroplasticity helps the brain rewire itself by strengthening existing connections or creating new ones between the eye and the visual cortex. This process can involve changes at multiple levels, from the retina to the brain's visual processing centers. Visual experience and targeted therapies can guide this plasticity, encouraging the brain to better interpret signals from the amblyopic. One common approach is patching, where the stronger eye is covered to force the weaker eye to work harder. This method is most successful in children, but it often has limited results in adults because their brains are less plastic. However, newer methods like perceptual learning involve repetitive visual tasks, such as identifying fine details or adjusting contrast, which can lead to meaningful improvements in visual acuity in adults. These training exercises help the brain adapt and strengthen the pathways related to the weaker. Researchers are also exploring experimental treatments that manipulate neural activity. For example, in animal studies, temporarily inactivating the stronger, with certain agents has resulted in remarkable recovery of vision in the amblyopic. While these methods are still under investigation and not yet approved for humans, they show that the adult brain may still have untapped potential for change. Another promising approach is Dichoptic training, which presents different images to each eye simultaneously. This encourages the brain to combine input from both eyes and reduces suppression of the weaker. This method not only improves visual acuity, but also enhances binocular vision and depth perception, which are often affected in amblyopia. In summary, evidence indicates that amblyopia can be at least partly reversed through neuroplasticity, even beyond childhood. While early intervention is still the most effective, adults are not necessarily beyond help. Advances in visual training and experimental therapies suggest that the adult brain retains enough flexibility to improve vision. It's important to remember that these treatments should always be guided by eye care professionals, as individual responses vary and some methods are still experimental. Combining traditional treatments with emerging neuroplasticity-based therapies offers hope for better outcomes for people of all ages with amblyopia. If you or someone you know has amblyopia, consult an eye specialist to explore the best options tailored to your specific needs.